It always feels a little stressed when it's like 5 minutes per person. So let's go. Let's just start from the top left, I suggest. And then Marieke can start with what she sees happening and her suggestions. Okay, Marieke, go ahead.
Yes, so I am here to talk about mental well-being and having a routine in that, because, well, the world is like going, well, not crazy because I don't want to go there, but there's a lot happening. So mental well-being is important, I think. And having a routine in that so you can consciously and constantly improve your life, the way you think and the way you operate is very important to me. We have routines and protocols for just about everything we do to take care of our bodies. Brushing our teeth is a daily routine every child is taught as soon as the first baby teeth crack. And our bathroom cabinets are filled with creams and soaps and shampoos and all kinds of stuff to keep our bodies clean and healthy. But a routine for our brain, to break free from habits that no longer serve us or keep us from thoughts that keep us small and miserable, and tools to help you get centered and be grounded and happy. That's something most of us just are not used to. And we aren't taught any of that in school. We don't have a clue of what we are capable of when we start nourishing and cherishing our brains and our mental power. And to me, that's weird. You don't start brushing your teeth when you have a cavity. You brush so you prevent them. And in the case of mental well-being, all too often it's something we start working on when the mental cavity has already presented itself, like burnout or something like that. So I'm making a case here for having a routine for your mental well-being. And to me, it's preferable to do that in the morning. Not just because your brain waves are slower in the morning and whatever you want to suggest to your brain is much more easily just programmed. But mostly because the saying, a good start is half the work. That's a Dutch saying. That's really true. If you can start your day powerfully and with meditation and with taking some time to manage your emotions, with getting your body into motion, with working on healing things from the past and setting yourself up for a great future, there is so much power in that. And to me, energy is everything. And I'd like to take you through a little bit of visualization. So I'd like you to close your eyes for a second and imagine yourself getting up and immediately getting yourself caught in the daily rat race. You jump out of bed, you yell at the kids to get them out of bed. You are making breakfast with your heart thumping from the stress your day is already giving you, and work hasn't even started yet. Okay, how does this make you feel? And okay, now wipe the slate clean, just relax for a bit. Now imagine opening your eyes in the morning, taking a deep breath, and smiling. Simply taking some time to find the deep peace inside of you, starting your day on your own terms. You keep the world away for a few minutes, maybe even half an hour, to take care of yourself, to tend to your needs, and to really center yourself. Do you feel the difference? And what if you start working from that place, from the place of peace, from that place of power? And this is exactly why I created Morning Magic, a follow-along morning ritual, because I firmly believe that the way you start your day is the basis for the flow of that day. A good start makes for a good day, and good days make for a good life. So I'd like to invite you to look at your routine for your mental well-being. Do you have a routine for that, or do you just go with the flow, or do you resist? And what can you do? Which small steps can you take to increase your peace, to reduce stress, and to live your life fully and presently? And that's what I think is missing in the world a lot of times. Just the routine for your mental well-being. I'm not talking about mental health per se, but the well-being and the things we can do for that, if we can create routines around that, that would be enormously helpful. So that's what I wanted to share today. Thank you for your time and your attention.
Good. Thanks, Marieke. Johan, what do you want to share about? And Marieke, if you have tools or a website you want to share with the others, you can put it in the chat. So feel free. Johan?
All right. I would like to give you an update on Health 4.0. So coming back from the pharmaceutical industry, where I was responsible for innovation on the pill, which is meaning smart pills, precision pills, innovation around the pill, which are services. I stepped out in 2012 because I was thinking the pill is a little bit wrongly positioned in the entire system. So we created Health 4.0, which is salutogenesis, which is a paradigm shift in healthcare. And why is that a paradigm shift? And I don't have to explain you this, but if you look to the work of Otto Scharmer and Kate Raworth, then we are creating the results that we do not want. And if we look to how we are going to do that, so if you look to the evolution of healthcare, and I'm starting with Health 1.0, we had the traditional family doctor who knew all the brothers, the sisters, the father, the mother, the grandparents, the working conditions, the social life. Then in Health 2.0, everything was science-centric. So everything was derived from data, evidence-based. And now we are moving into 3.0, which is patient-centric. So we flex the knowledge of the science-centric part around persons. So that becomes personalized care. That is meaning that the newborn is analyzed with DNA already to start treating what the baby could be suffering from in the future. But if we look to Health 4.0, we turn the camera and we are no longer looking to diseases, we are looking to health. And doctors are agreeing that they have no clue. They have not been studying this in their curriculum. So if we look to the worldwide situation, 70% of well-being and healthcare is coming from factors that are totally outside the medical care system, which is accounting for 10 to 15% of gross domestic product. 20% of the effect is realized by the healthcare system and 10% by the genetics. So we wrote a paper that we can provide better health at a lower cost. And my conviction is that we can bring the cost of healthcare back to approximately 3% of gross domestic product. So that is talking about really big numbers, but also providing a better experienced health by every individual citizen. So if we look from a strategic point of view, the whole world today is trying to look at diseases and trying to understand the statistics. So if I'm with the doctor, he or she starts to write after 5 minutes. And when I leave the office, they are saying, you can call tomorrow for the results. When I'm calling, their eye is totally fixed on the results, on the data. And they forget about the person, they forget about the environment, they forget about everything else. So everything is squeezed in the quadrant of disease and statistical relevance. And we forgot clinical relevance and systemic perceptions. So if we have somebody who is born, you are losing in that first frame gradually your health. So you get your first symptoms, they are diagnosed, they are treated. And because we only treat the symptom and not the cause, we get into a wicked problem situation. Then we enter as individuals in the second frame, like for instance, where I'm coaching teachers. And when they when they are at the end of a burnout, they hope that the kids are reasonably calm. But the kids come from home under pressure. They have been drinking Red Bull. They have not been eating. So the kids are not calm. So the school management is throwing on top of that a number of extra regulations. So in that second frame, we are making each other sick. And then we are losing more of our health potential at the end of the second frame And then the coping mechanism starts. So then we think if we can have that car or that house or that fiancé, or we can go to the hairdresser, then we will be happy. And that is counting only for a limited amount of time. So we are depleting the resources of the world, and that is weighing on us in the next cycle. So we are becoming much and much more unhealthy. So if you look through a traditional value chain from prevention, screening, early diagnosing, and you look from the lens of Health 2.0, prevention, of course, equals vaccination. But when you change your mindset, you see that you have totally different options. And I'm coming back to the salutogenic education in a moment, but you have a wide arena of new innovation opportunities once you are going to look from a different point of view. So what you see here is that doctors basically are treating patients on the lower 3 levels. So they are diagnosing and treating symptoms, but symptoms are a coping mechanism of an adaptation. These adaptations, they are caused by loads that we feel, which are allostatic, ecological, iatrogenic. And that causes, and that is the effect of disturbances that we feel in our balance because we have other leading principles. Maybe we are too money focused or too whatever focused. So we are gradually losing the still points, which is the point that we still are perfectly in shape and healthy. So what do? So we have made demonstration projects to create healthy individuals, healthy practices, healthy families, and so on. So we have worked over the past months with homeless people that had no perspective, that have costed a lot to society. And in 4 to 5 months, they are totally back on track. And they are even performing better than a lot of the average citizens. And it's because it's about going to look where the problem is starting, where the deviation of losing health is starting. So we made a television program, 40 sessions, where we are teaching children how they can learn about taking care about their own health. All the findings have been discussed in a think tank with professors and medical specialists. And basically, the way forward now is that all the demonstrators, which were projects in exploration, we are going to transfer them to the right side, where we are going to scale them up. But also the professors have said, okay, by bringing Health 4.0 to the surface, it's opening up a totally new field of research, academic research. And from a policy point of view, I'm working on getting a new health deal, as we have already seen the new Green Deal on energy. That was my presentation.
Thank you, Johan. Can I be the host again?
Hello, everybody. My name is Ivan, already mentioned. I'm a nutritionist and wellness practitioner from Uganda. I've listened to very many various ideas, and most of what I've had today intertwines into what I wanted to share today. I've come to realize that when it comes to healthcare, it's much more than just nutrition. Even though I'm a nutritionist, there are 7 other dimensions to well-being. And Marek already mentioned the mental well-being. I loved what Johan said about the healthcare system, where we're dialing it back from disease care to preventive kind of care. And this is what I'm into. I'm into prevention. So we realize that people want to be well and healthy. They don't want to have a very good doctor or a very good nutritionist. They want to feel well and they want to be healthy. And we realize that people are usually in places like social media, maybe television, all those other spaces. And it will be very difficult to always get them into the clinics to tell them maybe about what kind of services or what kind of systems or dietary changes they can make. So we decided to develop an application. It's like a social media application, but it's basically focusing on health and wellness. So it's called Fresh Health, and it will be probably out soon, but it's still in the development process. So this whole application gives us a fun, rewarding, exciting, kind of like an approach which is fresh to healthcare, which is not to prevent all this through their daily lifestyle. So we partner with them on a daily, so they get to see tips, they get to read articles from people like all the professionals who I see on here. They get to have an easy access to these people, not having to maybe search for their websites or maybe looking for their social media handles. But every practitioner can have their own account on the application. They can answer the questions for free. They can do all those things for free. And maybe if the person wants to engage with the practitioner, maybe on a further level, in a personal consultation, maybe then they can pay for the consultation and have that kind of session. So it's something that we've done, I think the first sprint is already completed. And we would like people to look into this kind of healthcare approach. Like, I like the way he's off now, so I can't tell his name and I can't pronounce it. Johan, yes, Johan. And I mentioned the whole prevention process. So that's what we're into right now. I would like to stop here, as I understand that time isn't the best friend today. But I think that's just a rough picture of what I'm about and what I love to do. And what I think would be the next solution to what we want to do, to make sure that people are, can I say, absorbed in this healthcare as part of their lifestyle, because they're always on their phones and social media. So we can get them into the space where they can share their food, share their ideas, share their meals, share their running. We can put specific ads that are specific to maybe healthcare events, things that keep them and their minds conscious of healthcare before they get to the hospital. So doctors will no longer have to sit in hospitals waiting for patients, but basically partnering with patients or clients to make sure they don't become patients. That's basically the concept. Thank you so much.
Thanks, Ivan. I think with Humanity Solutions before, we also looked at how Africa as a continent is the fastest growing population. And Ivan has been looking at undernourishment, but also now the new diseases that are coming like coronary or diabetes, because that's also coming to Africa. Great. Okay, Shari, I hope now we can hear you. That would be nice.
I think I have figured it out.
Great.
I changed the mic, and I'm definitely less prepared than you guys, and I won't share something about my work. Maybe it's connected to my work, but it's more like a food of thought or an impulse for the work that you're doing. So I'm working with a lot of startups and healthcare stakeholders, mainly within Europe. I also have my own startup working in telehealth. And for me, this is a very unique time. The corona pandemic is, of course, something very awful that happened to us. But in terms of digitization and innovation, it promotes quite an interesting development. And I'm aware that this is different depending on the region that you're in. But at least speaking about Europe and in particular Germany, it led to much faster rate of adoption of digital health in Germany. I can give you one particular example. For example, in Germany, therapists weren't allowed to use telemedicine forever, basically. And during the pandemic, it was suddenly allowed every now and then for a few weeks. When it got worse, then it was forbidden again, and then it got worse, and so it was allowed again. And the result is, after 1 year of the pandemic and testing and therapists getting more familiarized with the new technology, it will now be part of a new law and a new movement. So it will be actually adapted to regular care, no matter of corona or not. And I think that's quite an interesting development. And I actually have two pleas for you guys, being in the entrepreneur field and innovators field. The first thing I believe is using this unique time to promote what you're doing and to use the opportunity to promote digital solutions that can have an impact during the pandemic, because we need it, but also beyond and after. And the second plea I have is, while we are in this unique time, don't forget to collect data and use cases beyond the pandemic, because the worst thing that could happen to us if innovations are recognized only as a solution for the pandemic, but there's so much more that we can use these innovations beyond that. And my big hope is that after we've gone through this awful period of time, we learned a lot and have a better healthcare system that is, first of all, better prepared for unfortunately probably will happen another pandemic, and secondly will be more effective in treating patients and not yet patients, I guess. So yeah, that's what I wanted to share with you guys, and I would be interested in maybe we have some time for discussion later on how you receive the intersection of digital and the pandemic in your life or in your region, because we have quite an international crowd here, I believe.
Everyone can react to that question also in the chat, and we see if we find time later. I think there's quite some people in this group who also just wanted to listen in and not necessarily speak. So I think we will see that how much time we have left. Thanks, Sherry. It's interesting that it's becoming law now so quickly in Germany, because this can normally take 3 or 5 years. That's special. Raim, what can you share with us with what you see around health, or what could be useful?
Did you call my name? I think.
Yeah.
Oh, okay. I wasn't sure, sorry. So thank you so much for the invite. And there's a lot of things. I've not been in one of these conversations before, so I was trying to listen in from others on their contributions. But you had some questions in the agenda, and I looked through those, and I thought there are a few things I want to talk about. So I think the biggest issue for me in this year, so in 2021, and considering where we've come from, or where the world, or how much we have developed, we still feel we are helpless with this pandemic, or what the world can do, or how we can address this situation. It is a humbling experience being a medical doctor, being a scientist, being a global health professional. We are struggling to contain a global pandemic in this day and age. This is not 1918 when we had such a big scale of pandemic. So it is, as I said, it's humbling, but it's also it's challenging as well. So I think for me, the biggest issue is access to healthcare services. I work mainly in low-income countries or vulnerable countries around the world. And in terms of improving access to healthcare, so that's a big issue. And we might have thought in countries in Europe or United States or North America, access to health services was not an issue until the pandemic happened. And you can see, even in developed countries, it has exposed all the gaps that were there. It has exposed the systemic gaps within health systems across the developed countries as well. In some cases, some of the lower income countries or least developed systems were better off dealing with the pandemic than the richer or perhaps the richest countries in the world. So it has turned our understanding of access to healthcare upside down. And in some ways, there is so much more that needs to be done in terms of improving humanity's access to healthcare services. I was looking for an index, and I found a picture. So let me try to share. It's an index for health access and quality. And you can see even some of the richer countries like the UK is not on the top of the world in terms of increasing access to healthcare services, and the United States as well has had issues with it. But regardless, this is quite dated. It's from 6 years ago. But with the pandemic, we have seen ventilators not being enough, even frontline staff not being enough in the richer or the richest countries. So you can see France, Germany, Spain, and Italy, and the Scandinavian countries all have the highest, or they scored the highest on the index. But all of them struggled quite a lot with the pandemic over the last 1 year. So it has been a big challenge for all of us. Just thinking about the countries where I work, or the places where our programs are in terms of improving healthcare access in sub-Saharan Africa or in Southeast Asia or Asia or Latin America, it is embarrassing in some ways, or perhaps outrageous, that some of these countries or some of these communities or children still do not have access to basic services. We're talking about ventilators or really advanced technologies, even vaccinations. So now there's a queue for access to vaccines that are being developed, and they've already been bought before they are being manufactured by the highest income countries. And countries in Africa, for example, don't have, their turn would come perhaps in 2022 or even later at this stage. So in terms of, say, access to services, we still have, say, children dying from the most easier to treat illnesses such as diarrhea. It costs like 2 cents to treat a child with diarrhea, and they don't have access to healthcare. Sometimes mother walks for miles and miles or hundreds of miles to get to the nearest health center to see a doctor who may not even have any medical supplies or treatments. So we live in a world where there is so much inequity, or there is so much disparity in terms of access to care. And I think that's the most worrying bit for me. We live in a world today where you have richer countries and they felt or thought that they have access to everything. And the pandemic has exposed all the challenges that they had. And on the other end of the spectrum are the poorer countries who don't even have a decent health system in place. So I don't have answers, but it's probably more questions. And that's just sharing my reflections.
Yeah, the inequality bit is something we look at more towards the end of the year, but it is one of the major challenges.
Okay. So a lot of people have spoken about the things I also wanted to highlight. Perhaps I just want to reiterate something to do with access to healthcare. So I work in a telehealth organization. I am a mental health advocate as well. And I work on issues to do with access, especially to mental health care. So what the pandemic did was expose a whole lot of cracks in the system, but it also exposed opportunities at the same time. So it made us realize that we cannot only depend on the traditional health systems, but we need to look for ways to navigate and see how we can possibly offer mental health services to different people. So it got us thinking, what could we do? In what ways would people be able to access healthcare without necessarily having to see a psychiatrist, without necessarily having to see a psychologist? So with mental health care, it comes with a lot of stigma around it as well. So we had to look for ways where people would be able to confide in people within their societies. So we trained a couple of people on how they could be able to guide others to help them through certain situations, because we saw there was a peak of anxiety because of, the pandemic. There was a lot of depressive episodes in a lot of people. And then the pandemic in a country like mine, I come from Uganda, also in a lot of ways, for those people who had already been diagnosed with certain illnesses, because of the strict restrictions, there was limited access to getting medication. So we were struggling and battling with trying to keep a balance, trying to protect people from the pandemic, but also still giving them health care. And then that's when I realized perhaps, one, we could leverage on technology, because everyone these days is on their phone. So what could we do to be able to still provide health care while people are still in the comfort of their homes? Safe from, the pandemic, and yet still safe from themselves, perhaps, and also safe in the sense that they can get all the health care that they need. So we realized there was a lot of opportunity in digitalization of healthcare. I think there was a speaker from Germany who spoke about that and said that there was a whole lot of shift, and there was a change in how people perceive telehealth, because they had never really looked at it as an option. And because of the pandemic, everyone was forced to actually look to telehealth as the only solution. So it was very intriguing, because I think there was just like 1 or 2 companies that were doing telehealth in Uganda. So at the time, their business rose it was at the peak, because people had to look for healthcare that was still within the restrictions that had been put. So this pandemic brought up a lot of gaps in the healthcare system, because we already knew there were a whole lot of gaps anyway. Because as we said, a whole lot of people aren't getting access to basic medication. But this pandemic, I think, woke up a whole lot more people. And there was a whole lot more discussion about what can we do, because it just seemed like the disparity was getting wider and wider. So, that's just what I wanted to talk about.
One question, what we will do towards the end of this talk, and we will get there in 10 minutes, is look at a few web domains and ask ourselves in group, what could we do with this to benefit humanity? What could be built on this? But the first question I have maybe for this group, just in general, is, okay, there's the question of access, and then there's this opportunity of telehealth, or health to your home, and what's not so clear to me is what can easily be done via the online and tele, and what not. Can anyone speak a bit more to that? What can you do via internet, and what must you do physically? Is that very clear cut?
I can tell a bit about from our experience. There's no clear cut, I'd say. It really depends a lot on the patient and a lot on the practitioner, first of all. They have to get used to the technology, and there has to be established a basis of trust. And I think that's the most important part, because if a patient comes into a practice, you see so much more, right? So you see how he walks, you see if he comes alone or with the spouse, you see how he reacts, and it's very difficult via digital technology. And so you need some trust that the patient tells you actually more what he or she is feeling and what's happening in his life. And so I think for some patients, they build a really real relationship with their therapist over time. And this works pretty well. Of course, there are some very dangerous diseases that you really cannot diagnose via video chat. So I rather think for anything chronic, so that needs a long time treatment, it can be very useful. And of course, everything that can somehow be seen, right? But in my personal opinion, the combination of telehealth and face-to-face health is most effective. So we should use telehealth in a setup where it's difficult to reach a practitioner, maybe even a very specialized practitioner, because that's also a problem, I think, all over the world, that you might not reach the right practitioner for your diseases, or the right expert for your particular issue. So for that, it can be very useful, but you still need a personal contact with a health practitioner from time to time.
Just to add on a little bit, I think it depends as well on the setting. When you look at a setting like mine, there's a whole lot that can't be done by telehealth, because a lot of people still don't have access to the tools that would be required for the telehealth to actually happen. So that presents a challenge. So because of that, a lot of times it's not a video call, it's just an audio. And there's a whole lot of things I can't see, I can't sense from that. So because of that, it limits what kind of healthcare I can give. But as well, it's an opportunity. As you said, there are a couple of specialists that perhaps are in Europe that would be the best to see this kind of patient, and via video chat that would be more helpful. So I think it comes with pros, it comes with cons, and then it also depends on the kind of setting that you're in. So because of certain limitations that we have in my society, in my setting, it causes a little bit of issues. I feel like it can work both ways. It can be a very good thing, and yet at sometimes it could be very limiting as well. So one of the biggest challenges we find using telehealth is the fact that people, because of the traditional sense in how healthcare has been delivered, it's very difficult to convince a person that I can still do my job effectively when I'm in a remote area and you cannot see me and I am just listening to what you're telling me. And this is only going to be best of trust if you tell me everything. As I said, I'm a mental health advocate as well. And it's challenging because I was offering therapy over phone during the pandemic. And it relies a whole lot on trust. And because I can't see you, I can't read certain things when we're in the room, I am going to only strictly just depend on what you're telling me. And I hope that I can be able to read certain undertones. But I'm human as well. And because this is new, it's not, the orthodox training I have gotten, then there are certain things I may not be too conversant with as well. So telehealth right now is something that is brand new. It's exciting. And a whole lot of people are, diving in to know how can we better this, because it's, looking like the future and people are looking for convenience a whole lot more. But it comes with its challenges as well. But I realize for chronic patients, it's working out pretty well, especially those that have been stable. So if someone is hypertensive or diabetic and they have been stable for a very long while, telehealth is something that comes as a plus for them because maybe they don't need to go to the hospital anymore. They can just have it via phone or maybe via video chat, and the doctor can be like, okay, let's continue with these medications. But of course, it presents differently for certain illnesses. So we just have to be careful on what illnesses can be treated via telehealth and those that cannot. But I think overall, it gives a new perspective and generally gives a better advantage to some of the issues we have, especially where I come from in regards to access to healthcare.
No, I just would like to bring in two perspectives. I've been talking on health in Africa. And basically, I think we should not be blinded by trying to copy, let's say, the Western system. If I'm talking, that's my second point, if I'm talking a lot with American doctors, they are saying if you want to have an example of the worst, you have to look to the American woman. The American woman is in such a bad condition, in such a bad health condition, and where the women were, let's say, the natural ambassador of health, who were keeping some balance in a family, who were aware about eating now and then in a healthy fashion, to do, let's say, a number of natural things. They have given away their entire authority to a highly medicalized professional world. And I think you have two stages. Stage one, I think, is before you start to automate everything, I think you have to have your foundation clean and solid. And I think there is so much that we have lost on knowing what health is, that I think we have to first do that. And then I think we can look into how can we optimize it with telehealth or with digitalized things or anything. But I think you have to first do the first thing.
Good point. Anyone else on this topic?
I had a point on telehealth as well. And we've trialed it during the pandemic because I was talking about the access issue, and we work in, say, villages or places where you can't have health workers who are really qualified. So in terms of increasing access, I think it's a really good technology can improve access for people who are away or far away from professional health workers. It does come with, I think one of the speakers was saying earlier, it does come with its own challenges or risks. And one of them is safety. So safety for not just the recipient of care, because you can't touch them. A lot of medical consultation requires examination as well. And just the feel, just by seeing the patient walking in the clinic and all, which you can't have. So it does compromise the safety of clinical consultation or the safety or even quality of the consultation and the outcomes perhaps for the patient. On the other end, it also sometimes it's not also safe for the practitioner themselves. in most places in the developing world, there's not enough litigation. In the developed world, in the high income settings, practitioners can be liable for damages if there is a claim for, say, medical negligence. So it does come with its own issues. And then the issue around regulation as well. If medical practitioners are based in one country and they are providing medical care to someone else in another country, they are not regulated by either side because the recipient is somewhere else. So there are question marks around the whole telehealth or telemedicine and how people sitting in different parts of the world could access healthcare through the technology. That there are challenges as well as benefits of the technology.
A good point. Let's see, Esther asking a question in the chat. In light of all the challenges presented by the newness of telehealth, does anyone have any ideas how it can be made better for the incoming years?
I've had most of the speakers talk about the challenges faced with telehealth, and they cannot be ignored. For example, during this pandemic, we got to realize that sooner and sooner, we may not have as much physical contact. So whether we like it or not, we may have to evolve. That's why we in my country, like some speakers have mentioned earlier, people were more willing to accept telehealth because there was a crisis and they didn't know what to do and they needed access to healthcare. So they just had to take that telehealth. And I'm thinking to make this telehealth better, we can do something called maybe, we can have remote stations. Somebody can have a nearby clinic or nearby health center or nearby, maybe even a garage, something where their vitals can be taken. There are things that you cannot physically do if somebody is far from you, but a healthcare practitioner in that country or that area, who has access in the area, can be able to take their vitals, the measurements, to do the examination, and maybe even fill out some notes that could be useful for somebody who is not very close to that person. That's one. Two could be the other challenge I've seen with telehealth, even though we're trying to make it better, is that internet access is not as abundant as it is in some places. For example, we even have some restrictions on our internet access in Uganda currently because of political reasons. But such things make this kind of telehealth more a dream right now than it will be in the future. However, we're looking into things like virtual reality. I think, and I don't know if people have heard of this before, but I know that this is already something that's already being made up. We're already having systems where you can easily, feel somebody as though you were there. So if we go in that direction, telehealth might be more efficient than it is now. And I'm very confident that in the future, maybe a few years from now, it may be the number one go-to thing, as I don't think this will be the only pandemic going to come. Thank you.
I also just see a lot of, I am amazed by how good it already is, the internet connection, when I talk to people around the world. And so I see a lot of economic benefits potentially to having people from around the world helping others with their medical or health issues. It can be tremendously interesting economically also, and the health industry and the budgets are becoming so large for the countries and the companies that it is also that in itself is becoming a financial problem. But is there anyone else who wants to add something on this, or shall we move to see if we can co-create a little bit something together for the humanity?
I just wanted to add that the internet speed, it's really, really surprising. It's really one of the biggest issues we also face in Germany. You would think like that we would have high internet speed throughout Germany, but it's actually our biggest barrier to telehealth because many regions don't have proper internet speed to allow a basic level of internet speed. So I think, that's something we definitely need to tackle. Thank you all for this interesting conversation, especially for you, Will, for bringing together so diverse people from so many regions, because that's quite rare that you can actually talk to people from all around the world. Thank you.
Okay, let's take some time to do a little experiment. Okay, let's do one exercise. I explained what we aim to do with Humanity Solutions and Summanity. On the one hand, we try to bring a diverse group of people together and bring different perspectives around the table. So this is now about health, but we will keep doing transitions around different topics, and you're more than welcome to join other transition topics, so it becomes more and more multidisciplinary. On the other hand, we also are launching things that could be useful, solutions, initiatives, we call them elements, that can be beneficial for the world. And I'm going to ask, this is an experiment for us. We've never done it this way with a group of around a certain topic. So you have a view here of Humanity Solutions. We are launching a number of initiatives, at least 12 this year, one per month for us. We have pre-launched 3 initiatives related to health that we feel people may be looking for this right now. They are Googling corona rehabilitation, or they feel their food is polluted or their air is polluted. So maybe they're Googling stop polluting, or they want to prove that they are immune, they have been vaccinated, or they have had COVID and they feel they want to do more activities already. So many people around the world are looking for answers in these areas. So we have bought these properties, these domain names, and we are looking to expand on them for the benefit of humanity. Why we do this from the internet is because the internet is gradually taken over by very big players, as you know, Facebook, Google, some Chinese variant. And it is becoming less and less a place of the people and for the people. So we are also acquiring some domain names to protect them, let's say, for all of us. But it's still experimentation phase to see, can this be helpful enough? I would love to ask you to have a look at these 3 domain names right now that you see. These 3 links. I will just also put them in the chat on Zoom.